A very good evening and a very warm welcome to all the doctors who have joined us this evening for yet another session in the series of NEFFRON. So, today we have a very interesting topic and we have a very young and dynamic clinical expert for the day, Dr. Jitendra Rajput. Dr. Jitendra Rajput has completed his MD from Gajraja Medical College and his DNB from Sir Gangaram Hospital, New Delhi. He has 9 years of experience in the field of nephrology and has been associated with prestigious hospitals like Sir Gangaram Hospital, New Delhi, Fortis Escorts Hospital, New Delhi, Gajra Raja Medical College, Gwalior. He has also some research and publications under his name and has been participating in various international and national conferences. With this, I would like to invite Dr. Jitendra Rajput to address the audience with a very important topic, that is the need of alpha keto analog in the management of chronic kidney disease. So over to you.
Good evening, everyone. Today we will discuss a very important topic, that is the role of alpha ketonologues in CKD. As we all know, we advise for protein reduction for decrease in the CKD progression in CKD patients, but most of the time it can cause malnutrition in the CKD patients. So, what is the role of alpha ketonologues? Are they really effective in preventing the progression of CKD? And what are the studies behind it? And what are the doses for alpha ketonologues to be used in patients with CKD? Next, please. Next, please. So, what is the goal of treatment in CKD? It is to prevent or slow the further damage to the kidneys and maintain the overall health, reduce the toxins and nitrogen load, balancing the intake of energy, protein, sodium, potassium, phosphorus with biological markers and the weight change. So, dietary intervention is one of the most key management in the CKD management, along with the management of other things. Next. So, introduction to the alpha keto analogs. The keto analogs of the amino acids, they are the nitrogen-free analogs of the essential amino acids, and alpha keto analogs, they transaminase in the body to form the essential amino acids. They reduce the uremic toxin load along with correct the amino acid deficiency while we advise for the protein restricted diet, and they delay the dialysis and delay the progression of CKD. So, what is the mechanism of action? So, after ingestion of alpha ketonologues, they basically transaminase to the essential amino acids via transaminase, and this process reduces the need for the dietary protein intake. Usually, we advise for 0.8 gram per kg per day protein intake in the CKD patient so that the overall nitrogen burden will be reduced, and while ensuring the adequate protein synthesis. The reduction of the nitrogenous waste, unlike dietary protein, alpha ketonologues, they do not release the additional nitrogenous during the metabolism, and this will reduce the urea, ammonia, other nitrogenous waste products, and thus decreasing the workload on the damaged kidneys. So when we consume the alpha keto analogs, so after ingestion, they transform into the essential amino acids, and thus the urea production will be reduced while we take the normal protein intake. This urea will be produced during their metabolism, and thus it increases the this nitrogenous load on the kidneys. Next, please. So, talking about the composition, that is the main is alpha keto acids. These are the core of the medication. Each alpha keto acid corresponds to the specific essential amino acid. For example, alpha keto isocaproic acid is the alpha keto analog of the leucine, and they are often bound to the calcium salts to improve their stability and the absorption. Essential amino acids and essential to the keto acids. Some formulation they also include the essential amino acid themselves, like the lysine, threonine, tryptophan, histidine, and tyrosine. So, what is the need for double strength? The need for double strength is mainly because the compliance and the dose pill burden, to reduce the pill burden, and there is a different patient profile who don't want to consume multiple tablets. So there is a need for the double strength of the alpha ketone arise. Next, please. So what are the clinical indications of single strength, double strength? In single strength, we usually prefer in early stages of CKD, stage 3, stage 4, with dietary protein restriction, and elderly patient with a reduced dietary intake. For double strength, in the advanced CKD, stage 4, stage 5, with rapid GFR decline, and malnutrition in the post-transplant or the post-cardiac surgeries, patient with poor adherence to the high tablet loads. That is a pill burden. Next, so dosing administration, single strength, we advise for maximum of 6 tablets per day, and double strength, we advise for maximum of 3 tablets per day. Next, so overview of the clinical benefits. First, that is, they slow the progression to ESRD, reduces serum urea, creatinine, and the phosphorus levels, improve serum albumin and the nutritional markers. They delay the dialysis and improves quality of life in the pre-dialysis patients, reduce oxidative stress as well as the metabolic acidosis. Next, please. What are the various clinical trials? There is a trial published in 2016 in JASN, done by Garneta et al. It is a randomized controlled trial which included 207 patients of the stage 4 CKD, and they proved that the alpha ketone along with a very low protein diet reduces the dialysis initiation 13% versus 42%, and improved phosphate and the urea, as well as there was no malnutrition seen in the patient with the alpha ketone plus very low protein diet. Another trial which was published in dialysis nephrology transplant, done by DI Lorio et al. In 2012. It is a prospective cohort study, included 124 patients with the stage 3 to stage 5 CKD, and they proved that the GFR decline was comparatively slow in the patient with alpha ketonolog along with the low protein diet. It was 1.8 versus 3.4 ml per minute per year, and improved albumin as well as the phosphate levels were seen during the study and delay the need for the dialysis. Another study, it was also published in the Dialysis Nephrology Transplant, done by Chev et al. In 2009, and it was a multi-center longitudinal study, and they mainly included elderly CKD patients. Alpha ketone helped to maintain the serum albumin level, prevented weight loss, and was very well tolerated in the long term. Next slide. So, in the KDIGO guidelines also, they have in 2020, they included the role of alpha ketonologues along with a low protein diet. That is, they prevent the progression and maintain the nutrition. Another trial it was done by Milovanova et al. In 2018. It is an observational study, included 80 patients, stage 3, stage 4 CKD, with the cardiovascular risk, and alpha ketone analogs reduce the inflammation, improve cardiometabolic profiles, and they're beneficial in the high risk patients. So they also reduce the inflammation along with the oxidative stress, uh, which is responsible for the progression of kidney disease. There was another trial published in 2007. It is a randomized control trial, including mainly diabetic nephropathy patients, and alpha ketone reduce proteinuria, stabilize creatinine, and they were found to delay the progression in the diabetic kidney disease. The MDRD study group in 1994. It is a randomized control trial, included 840 CKD patients, and they were found benefit of the low protein diet along with the alpha ketone in the prevention of CKD, and there was no malnutrition seen in the patient with the alpha ketone along with the low protein diet. Next slide. So these are the various studies we have seen in which they have proven the role of the alpha ketone. So what are the key takeaways for the practice from this session? That is the alpha ketone logs. They are effective in slowing the CKD progression and delaying the dialysis. They help reduce the urea, creatinine, and the phosphate levels, support the nutritional status without adding the nitrogen load on the body. And there are many RCTs and the KDO guidelines which supports their role in the in the prevention of slowing the progression of kidney disease. And they are mainly recommended with low protein diet. That is a zero point 0.8 gram per kg per day, so that the malnutrition can be prevented. And for single strength, that's the maximum dose of 6 tablets per day, and double strength, that is maximum of 3 tablets per day. Always administration with the meals to enable the transamination, and safe for use in the elderly patient, diabetic patient, and the high risk patient with the CKD. So, any questions for the session?
Thank you, sir, for a very comprehensive and crisp presentation. Here are few of the questions that we have received from the doctors and would like you to answer regarding the same. Especially, sir, talking about the Indian context, there has been a wide variety of patients that come to you. And when it comes to the protein restriction, so is there a difference that you see in the patient? How do you convince them on the protein restricted diet?
So we usually say to the patients that do not consume the non-veg diet. In vegetarian patients, we allow for one katori of a dal, that is they can consume daily or alternate day. And if they are taking some other form of protein like paneer and milk, then they should cut down on the other products. There is no, we don't advise for total protein cut down because there is malnutrition. We have seen the CKD patients, particularly in elderly patient, we don't much advise on the this protein restriction because they are often malnourished, and their weight is also very low. And so in young patients and around 50, we advise for protein restriction. And mainly in the non-vegetarian, we don't allow for the non-veg diet.
Okay, sir. So you rightly mentioned, sir, because there is no need or requirement of a very low protein diet to be suggested. Do you think that supplementation with alpha keto analog will help such patient irrespective of their non-vegetarian or vegetarian diet?
Definitely. Alpha ketonologues, they have been seen in the practice, that is, they slow the progression of CKD when we advise along with sodium bicarbonate and other essential drugs for the CKD prevention, along with the diabetes and hypertension control. And nutritional advice we give for the this what to consume, what not to take in CKD patients, so that maximum their GFR decline can be reduced.
So this brings me to another question regarding when do you start the alpha keto analog therapy? Like which are the clinical indicators that you notice? Is it the EGFR or the creatinine, serum creatinine and the protein urea level?
So definitely eGFR is better as compared to serum creatinine. Stage 3, I think below 60, we usually start in such patient. Above 60, I think there no much role of the alpha ketonologues in the prevention of this. But definitely over time we are using it, and we have seen that those patients, even young patients, they are on alpha ketonologues and they are maintaining their GFR very well over years.
So since there are a lot of diabetic nephropathy patients that there has been an increase in the number of patients who have been screened for diabetic nephropathy. Almost like 80% of the patients have been suffering from diabetic nephropathy. So is there any advice that you would like to give to the physicians when it comes to, referring early to a nephrologist, and what should be the kind of routine they should follow, and what are the tests to be done to identify early the diabetic nephropathy in such patients?
For diabetes nephropathy, early we advise for testing for microalbuminuria. If there is a patient have developed microalbuminuria, definitely you should consult a nephrologist as early as possible. And so, if we talk about the guidelines, they usually recommend if the GFR is less than 60, you should refer to or you always take advice from a nephrologist why this GFR decline is there. And even from educated patients, they consult us from our early stage. Some patients are there who consult to a nephrologist late. Definitely, if you compare those patients, those managed by a nephrologist starting, their GFR decline is definitely reduced. There we have a new molecule like quinidone we are using in diabetic patients, which by the name of Kirandia. So that is definitely reduce the proteinuria in diabetic patients, even in the early stage, so that if their blood pressure is low, they are not tolerating asymptomatic ARBs. So we can add from the early stage.
Right. I think this will be very helpful for the physicians to understand and timely refer the patients to a nephrologist. So one last question is regarding the dialysis. Like what outcomes you have seen in the delay in the progression of the disease in dialysis patients with the use of alpha keto analog?
So definitely the GFR decline is reduced after using the alpha ketonologues. If we compare those patients who are taking alpha ketonologues versus those who are not taking, I think there is a huge difference. If we compare by year, ml per minute per year, there are definitely 3 to 4 GFR decline. There will be a difference per year if we use alpha ketonologues.
Okay, sir. So there is a definite slowdown in the progression of the disease with the use of alpha
Definitely.
keto. Okay, sir. So, one key takeaway for all the doctors who have joined us today from your practical experience in the clinical setting with regard to the CKD patients and the use of alpha keto analog that you would like to share.
Uh, CKD patients, there is a risk of with the protein restricted diet. We always know okay, there is a risk of malnutrition. So alpha ketonologues, we can be used definitely when the GFR is less than 60, and there are proven trials now, and even the critical guidelines also recommend that is the use of alpha ketonologues in CKD patients, particularly in stage 3, stage 4, to prevent the progression of kidney disease.
Thank you so much, sir, for answering all the questions with a very crisp and comprehensive manner. And with this, we come to an end of the session. I would like to inform the doctors who have joined us today that this session, the recorded session, will be available on YouTube, and you can watch it anytime and share your comments or any feedback that you have with regard to the session. And with this, I would like to propose a vote of thanks to Dr. Jitendra Rajput for joining us this busy evening and sharing his insight, his very practical insights on the use of alpha keto analog in the management of CKD. Thank you, sir, for sharing your insights. We look forward to your continued support and guidance. Thanks a lot.
Thank you, thank you, thank you. It was a nice session. Thank you.